Welcome to the Popkin Method, a show where real medicine meets real results. Today, we begin with a truth too many people are afraid to say out loud. You're not lazy, you're not crazy, you're not broken. Your care is just fragmented. Today, we meet the physician who's changing that, Dr. Matthew Popkin. Dr. Popkin went to medical school at the University of Miami School of Medicine and did his general and orthopedic surgery training at Mount Sinai Medical Center in New York City, and also his internal medicine training at the Cleveland Clinic Foundation. And now he's building a new standard of care that blends internal and functional medicine without the fluff or the guesswork. In this very first episode, we go behind the scenes into Dr. Popkin's journey, his frustrations with the current system, and the origin of what he now calls the Popkin Method. Let's dive right in. So, Dr. Popkins, let's start at the beginning. Not as a doctor, not as a person, but where were you born and raised, and were either of your parents a doctor?
So actually, I was born in New York and raised part time in New York and part of the time in Florida. My folks had gotten divorced. So I lived in New York till I was 9, and then we moved to Florida. And I had moved back to New York when I was 15, completed high school and college in upstate New York. I then went back down Florida for med school at University of Miami School of Medicine. Then I went back up to New York to do my general and orthopedic surgery internship at Mount Sinai, Manhattan. And then I came back down to Florida to go do my internal medicine residency at the Cleveland Clinic Foundation. I had also afterwards done some postgraduate fellowship training in HIV and infectious disease medicine at the University of Texas at Galveston. I set up shop in Florida in 1999, and I've been here ever since. To answer your second question, are there any other physicians in my family? I'm the only physician in my family. My most of my family is in healthcare. So when I was growing up, I didn't have a physician mentor, so to speak. My grandfather, he was a pharmacist, and my mother, she's a nurse. My father was a purchasing agent for hospital systems. So I was exposed um, to medicine at a very early age, but not necessarily anyone that was a physician that made me feel that I had to become a doctor. And interestingly enough, I knew when I was 3 years old that I wanted to be a doctor, and I had a little doctor's kit. Doctor bag and all the plastic doctor tools. I used to sit on my grandfather's lap and pretend I was a doctor. And some of the television shows back in the 70s, one of them was a show called Emergency, and it was about firefighter, paramedics, EMS workers in California. And they would always have to report back to the doctor at the hospital, and they'd get on their phone and ask him questions, and he would tell them what to do. And I always thought I want to be, the guy in the white lab coat, not necessarily the guy that's out in the field. And so I think that those are some of my early influences. But I knew when I was 3 that I wanted to be a doctor, so this has been a calling for me.
Now, Dr. Popkin, you've trained at some of the best institutions in the world, the University of Miami, Mount Sinai, Cleveland Clinic. So, did you ever feel like something was missing in traditional medicine, either as a doctor or as any experience you may have had as a patient?
Yeah, people talk about the cracks in the system, and I call the cracks in the system the gaps in the system, or the gaps in patient care. So part of this is just related to, I think, fragmented care that occurs when there's multiple physicians. Nobody's really taking the lead. There's too many referrals out to other physicians, but the care is not necessarily coordinated. And then you get into other aspects of medicine where people talk about Eastern medicine or Western medicine, or they talk about traditional medicine or what's now termed functional medicine. And I think a lot of what happens is you don't get that coordination of care, and that causes gaps in the care. And unfortunately, it's those gaps that the patients are really suffering with. Patient can have diabetes and high blood pressure and high cholesterol. Physician can prescribe medications for all of those things. And whereas on paper, everything may look good, blood pressure's normal, blood sugars are within normal range, blood pressures look good, but the patient may not feel well, and the patient may not have they may not feel well because they're tired or they're not sleeping well. They're gaining weight. They just overall don't feel well. And a lot of times those questions and those problems are not answered, and that creates the gap in care that the patient's really concerned about. Because when they go home, they're not thinking about their blood pressure, and they're not thinking about what their blood sugar was, or what their hemoglobin A1C was, or what their cholesterol looked like. Or they're thinking about how they feel. How they feel when they wake up in the morning. Did they get a good night's sleep? How they feel, do they have energy, what their body looks like. Do they gain weight? Are they having hair loss? Things of that nature. And these are all the things that patients are concerned about just as much as, their blood pressure and diabetes and so forth. They just don't think about a lot of these things that the physicians are taking care of on paper. They think more about the things that affect them on a daily basis that they can see and feel. So that's really one of the things I like to focus on is closing those gaps in care and making sure the patient has all of their issues addressed.
And through that, was there a specific time or when did you really feel like you started to perhaps see the cracks within the system?
I think right from the start, from medical school on, when we got out of the book learning portion of it and got into the clinicals, we would start, you would start to seeing patients. And back then, at that stage of training, you would talk to patients and you would literally be with them for an hour and a half, doing a history and a physical and doing all the different things that you're supposed to do and that you're taught to do. And when you give a patient an opportunity to talk and have someone to listen to, it's very easy to find out what they're not happy about. So again, it's rare that you would have a patient come in and say, my systolic blood pressure is 160. What do I do? My finger stick is, or they're in the 200s. What do I do? That's not really what they're complaining about. They come in and the doctor is really more concerned about those numbers. The patients are concerned with, the question. If you ask them a question, how do you feel? You better be ready for the answer because the answer is not always going to be something as simple as, blood pressure high. I prescribe medicine, blood pressure better. It's not always like that. And for the most part, medicine, there's an art to practicing it. And you have to provide that level of service where you actually care about the answer. So if you ask somebody, how are you feeling? And they tell you, I'm feeling tired. Well, now you've opened up, Pandora's box, so to speak, and you have many different things that come up in your differential diagnosis. They're not going to come up to you and say, I'm tired because I have anemia and I need B12 injections. They're not doing the work for you. You have to listen to them and find out what's really bothering them and address all the major concerns that you're supposed to do: blood pressure, cholesterol, diabetes, all the things we mentioned, but also the things that they are concerned about as well.
Now, I know a lot of people feel overwhelmed. They see specialists, there's apps now, coaches, and still feel sick. So, what's your honest take on why so many patients today are still struggling, even though there's so much more access?
Well, I think one of the things that happens is patients are subject to information overload. There's so much information out there that they have access to, and I like to call it, they're DIYing their healthcare. It's the do it yourself healthcare culture that causes a lot of anxiety in the patients because a little knowledge is very dangerous. And also, what I think is really interesting now as compared to, let's say, just 10 years ago, and certainly for many years past, is this quick fix Amazon care that we see. And I'm not talking about the Amazon where you can get in front of a doctor and that type of stuff. I'm talking about patients see something online. They might see a video for a supplement, let's say ashwagandha, and someone says, that someone learns that ashwagandha is good for stress relief. So they go online and they order a bottle of ashwagandha and they don't feel any difference in, immediately, right? They don't feel, and it takes In some of these cases, it takes a couple weeks or months to feel something from some of these supplements. Other cases, it's a lot faster, but they don't get the results that they're looking for. Maybe their issue is not necessarily stress-induced cortisol that ashwagandha would help, but perhaps what they're feeling is something else that would be managed with another type of supplement. So there, people are really doing things on their own without any professional guidance. So I think what happens is too much information is not a good thing. And I think the physician is the person that should be helping to coordinate the care with the patient. And I'm all for having the patient be part of the care team. In fact, I insist on it that they're central to the care plan. I just don't think the physicians should rely on patients to do a lot of the work that they should be doing. So it's interesting everything that's available to people, and sometimes it's too much.
And what's the difference between the average functional doctor or wellness guru online and what you're doing? Why does it really matter that you're also trained in internal medicine specific?
Well, I think, first of all, internal medicine is the backbone of a patient's health care. This is where you are dealing with the issues that we talked about: diabetes, high blood pressure, high cholesterol, asthma, emphysema, depression, anxiety, arthritis. You have to have a good, sound basis in internal medicine to fully address all of the complaints that a patient will have. Functional medicine should be a complement to, in my opinion, to internal medicine. And you should blend the two of them together. There should be a blend of them. It shouldn't be all internal medicine, no functional medicine. And it shouldn't be all functional medicine, no internal medicine. It really should be thought of as an add-on, a fine tuning, if you will. Functional medicine really fine tunes a lot of what's going on with the patient, and I think, both have very sound principles, but different patients need different amounts of each. So, for example, let's say a diabetic, early on in a diabetic's lifespan, when they first develop diabetes, or even prior to that, it's insulin resistance. A lot of the work is functionally based, and most of it is functionally based. If you practice good lifestyle modification, diet, exercise, employ some supplements that would help with insulin resistance, you can reverse the effects of insulin resistance and prevent diabetes. On the flip side, you may, when you take care of diabetics that are later on down the road, whose pancreas has really been overworked and really creates inefficient insulin, that in that particular sense, you're going to need more than just functional medicine. You're going to start having to get back into the internal medicine where you're prescribing medications either to increase the sensitivity of the insulin or increase insulin production, or just give insulin injections and replace insulin at some point. So it's a blend, and really the art is to know what that blend is, and it's going to change too between patients, because as patients, you may, and one of the things that I do is I like to take the patients, and if they are requiring medications right off the bat, prescription medications I'm talking about, but you deploy the sound principles of lifestyle modification and diet and exercise, you can take some of those medications away. And I think a lot of the patients are afraid to go to the doctor because they don't want to go on medications, so they just let stuff go by, or they figure they can fix it on their own, which is not generally a good idea. And I'll assure my patients, my goal, if I have to put you on a prescription medication, is to try to decrease the dosage or put you on the least amount, and hopefully get you off of medication if it's something that can be corrected. In particular, with diabetes or high blood pressure or high cholesterol, weight loss tends to really help with decreasing medication usage. So I think that helps patients to be more comfortable with the care plan. And I'm all for, not using prescription medications if they're not needed. And I'm obviously for using them if they are needed.
So let's say if someone happened to walk into your office completely lost, tired, and frustrated, how would you begin to help them?
Well, this is the focus of today's podcast, and that's the Popkin Method, which for me is it's the same blueprint for every patient. That it's a mix of internal medicine and functional medicine principles. But it all begins with the same thing, and all the architecture of the visit is the same. It's just a standard history and physical exam, really listening to the patient. So when you say history, you're listening to them and you're truly asking them for, questions, and you're getting the answers. Specific lab tests, imaging studies if necessary, preventative screenings that may need to be done, mammograms in women, colonoscopies in men and women, of course, age appropriate screening tests we're talking about. That's the basic framework. And then with a heavy, heavy dose of compassion. And I think that's important. It's certainly not unique to me. It's certainly something that I like to incorporate into all of my visits. I think if the patient feels that you're compassionate to their needs, they're going to open up more to you, and they're going to tell you more, and you're going to get more information out of them. And then you just listen to the patient, and they're going to tell you what's wrong with them. Just like I said before, you ask them what's wrong, and they're going to tell you they're tired, they're 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 gaining weight, they have poor sleep, they're not happy with their sexual function, they're losing their hair. They're going to tell you what is concerning to them. A lot of the questions that we ask, are the questions that are looking for other diseases. We're looking for questions, we're asking questions that are going to tell, does the patient have high blood pressure? Is it well controlled? Do they have diabetes? Is it well controlled? Again, the meat and potatoes of internal medicine. But again, asking the patient and listening to them as to what's bothering them, they're going to tell you what's wrong with them for the most part. If you listen to them, you'll get your answer more often than not. And then by doing good history and physical, proper labs and imaging and so forth, you're going to get your answer most of the time. And then, there are those outliers that don't fit into the mold, where you have to actually dig deeper, but eventually you'll come up with the answer. I think the main thing is just listening to the patient and being diligent. And then the treatment, again, it's going to be the same recipe, right? It's going to be lifestyle modification, it's going to be diet, it's going to be exercise, proper supplementation. So if a patient is, I like to, there's some core supplements that I like to put patients on for various things. I like to put all my patients on probiotics for gut health. I like them to be on omega-3 fish oils for inflammation and other aspects of health. Vitamin D3 and K2 is essential for most people. Magnesium is something that most patients are deficient in as well. And then a multivitamin, there's some really good studies that have come out on multivitamins that have brought them back into favor, that will show that multivitamins do have a longevity aspect to them. And then I fine tune things more. I like to put most of my patients on creatine. Creatine is a supplement that used to be, for the most part, bodybuilders were using creatine back in the day, and it would cause water retention in the muscles, and the muscles would look bigger. So it was a good effect for bodybuilders. But really, creatine is something that is good for energy production. It crosses the blood-brain barrier, so it gets into the brain, and it helps with brain fog and memory. There's a lot of really good studies on creatine. In fact, it's one of the most studied supplements that's out there. And most physicians that I speak to don't even consider putting patients on creatine, just because they're not familiar with the recent studies, and they're just not familiar with using it. So I think then, the next level up that I go to is I start to talk about peptides, the introduction of peptides into the care of the patient. And that's going to be another podcast that we're going to do in the next couple of episodes. But peptides, for the most part, are made by our body. They're short chain amino acid proteins that our body makes. Insulin is a peptide, for instance. And as the body starts to make less of them, we can replace them. So it makes a lot of sense to use peptides in different situations. So I utilize those a lot. And then medications, prescription medications, if needed. So again, it's a continuum, starting with lifestyle modification, going all the way up through prescription medications, if needed. And then really what I like to do is I like to empower the patient. I like them to know I'm the quarterback of their care, but they're also part of the care team as well. And that leads to compliance with the care plan, and that leads to trust. So there's a lot that goes into creating a relationship. That's why they call it a doctor-patient relationship. It truly is something that you have to foster over time. So if the patient trusts you, they're going to listen to you. They're going to be compliant with the care plan. They're going to get better. So that's part of the Popkin method, is to have the patient trust you so that they're compliant with the care plan.
Okay, wow. Yeah, so that's kind of how the Popkin method came into action. And I know you once described your work as integrating what actually works. So, can you tell me a little bit more about what that really means and how you do decide what belongs in your care plan? Meds, labs, IV, peptides, etc.
Well, again, the integration of internal medicine and functional medicine, that's the art of practicing medicine and determining what needs to be integrated into the patient's care plan. And some of the things that makes it a little difficult is a lot of the advertising that we see on television. For the drug companies are advertising like crazy on TV. Every third or fourth commercial, if you watch TV, is about a drug for something. And I remember years ago when I saw my first drug commercial on TV. I can't remember how long that was, maybe 15, 20 years ago. I remember being just amazed that there's drugs, pharmaceuticals were being advertised on television, and now it's everywhere. So patients have a lot of access to that information, as we spoke about earlier in the podcast, and then they go online and they get access to other information regarding prescription medications, supplements, other treatments, and things that they want. So a lot of times, the patient wants to integrate some of these things into their care plan, which I think is great when patients come to me. It shows me that they're engaged in their healthcare and they're going to be an active participant. From my standpoint, knowing how to integrate the different care plans and the different components of the care plan, so it really comes down to the experience of the physician and the comfort level of what we're integrating into the care plan. And when I say comfort level, doctors will take a course on doing various different things. Maybe they learn how to do Botox, or they go to a seminar on gut health and they learn about using probiotics and other supplements and medications to help and specifically address gut health issues. Maybe they get into food allergy testing. So, there's a learning curve with everything. So as they get better at doing what they're integrating, it becomes more of a part of their overall care plan. So there's a lot that goes into integrating everything from internal medicine to functional medicine, integrating what I want as the physician in the patient's care plan and what the patient wants in their care plan. So integration is very important to make sure that you close those gaps in care that we talked about earlier.
I know some people think that integrative means woo woo, others think it means just supplements. So, how do you break through those misconceptions?
Well, yeah, I mean, it's funny. I've been doing functional medicine before it was even called functional medicine. I mean, back in the day, they used to call it alternative medicine. Then anti-aging medicine, became the term, and then integrative medicine, and now that's kind of commingled interchangeably with functional medicine. So, I think that integrative or functional medicine, I think it gets a bad rap, uh, partially because it's not really taught in school. We don't learn these things. At least I didn't back in medical school, where you're learning more of the didactic learning and the book learning, and then you get into residency, and you're learning how to actually be a doctor, but you're so focused on the skills, you're not necessarily focused on ancillary type things. You're certainly not trying to integrate things that are outside the scope of what you've already learned. You're trying to be comfortable as a physician, so you're learning these things. So I think that one of the reasons it gets a bad rap is because it's just not taught um, until the physician is outside of their training. So it's generally something that the physician has to put the time and work into. And of course, there's people that are better at it than others. And I think that if you're not good at doing something and you cause patients harm, that could be a problem. Leading to maybe a misconception that functional medicine isn't real medicine. I like to think of it as more of an add-on, that happens after you graduate from your training program. It's more like a continuing education uh, uh, addition to internal medicine. And again, I think that one of the other problems is there's no coordination with the patient's primary care physician. And I say this because a lot of functional medicine principles are not necessarily um, they're not deployed by the patient's primary care doctor. It's the patient has learned something online and they went to another provider that they found somewhere. And typically there's no coordination there. So the patient may see something online, they may get solicited, they may, end up on an ad that, they get contacted by somebody or they learn information about another provider that is doing something and they'll go to that provider. And let's say that provider does something very specific. Let's say it's a gentleman who is getting testosterone replacement therapy. So i- the functional medicine physician that's doing the hormone replacement therapy really should coordinate with the patient's primary care doctor, and typically that doesn't happen. So I think it creates a bit of a conflict between the internal medicine physicians and the functional medicine physicians, right? Because without that coordination, the primary care doctor feels like someone's stepping on their toes and taking over, doing something for their patient, which quite frankly they should be doing as well. If it's a problem that the patient has addressed, it should be addressed by the primary care physician. So I think that causes a bit of a concern where maybe it doesn't have functional medicine doesn't get the best accolades, so to speak. And I think the other thing is that there's too many supplements out there that have no regulation. So many companies that make different supplements, they're not regulated by the FDA. So you don't know what's in these supplements. So what happens is when you're using non-standardized supplements, you create varied results. So for instance, I go back to ashwagandha. We talked about it earlier. Maybe patients talking to me about stress, and I tell them, "Oh, I'd like to put you on ashwagandha." Great. Where can I get it? Well, I have specific companies that I use because they're a trusted source. They have third-party testing. I've used the products myself, so I know that I'm going to get a standardized or a fairly standardized uh, result. Whereas if you don't give the patient specific directions, let's say, oh, just pick it up anywhere. Let's say they go to Costco and they don't get a product that is of any quality, then they're not going to get a good result, and then again, that leads to, a bad mark on the functional medicine report card, so to speak, right? So I think that, most, if not all, the supplements that I recommend, I either take or have taken in the past. So I understand what the patient can expect, what they're going to feel like. So I have a lot of experience not only in using them in my patients, but also in myself. So again, it comes back to integrating. You have to integrate these things into the care plan, and supplements, unless you have a good knowledge of them, you really shouldn't be prescribing or recommending them unless you really understand what they're used for, and also make the patient understand what they're used for so they can have expectations that meet your own.
And what frustrates you the most about the current medical system? And what do you really wish that every patient know?
I think the most frustrating part to me is it's kind of something I just touched on. It's really the access to the standardized use of internal medicine and functional medicine principles. The fact that these gaps in care that I talked about have to be closed by the patients going underground, so to speak, to seek care and close those gaps. That's very frustrating to me because it leads to fragmented care. It leads to what I talked about earlier. The patient has a primary care physician. They may have a couple of specialists that take care of different things. They may have a cardiologist, a gastroenterologist, a neurologist, and then you start adding other functional medicine providers to this. So, in the case I mentioned earlier, the gentleman that wants testosterone replacement therapy, he may go to another provider for that. He may go to another provider for hair restoration. And this is important because they may prescribe something like finasteride or minoxidil or do a stem cell procedure or something. And the care again is not coordinated with the primary care doctor. So that's frustrating to me as a primary care internal medicine physician. I like to coordinate the care and I like to know everything that's going on with my patient to make sure that they're not doing anything that's going to harm them. And this really the idea that the primary care physician should be coordinating both the internal medicine and the functional medicine care really is really part of the necessarily be doing for the patient, as long as I know what's being done for that patient and I can help integrate that into the care plan and function and participate in the patient's care plan and coordinate the care with another provider. Typically, most of the things that are being done from a functional medicine standpoint, I'm doing for my patient myself, whether it's testosterone replacement, whether it's hair regeneration, whether it's sexual health and erectile dysfunction treatment, weight loss with the GLP-1 medications or supplements. For the most part, I'm doing most of these treatments anyhow. And I think it's important to have coordination of care so you don't get those varied results and you do have compliance with the care plan and you close those gaps in care and the patient's happy. And again, it comes down to that question when you ask a patient, how do you feel? What's bothering you? What can I help you with? They're going to give you the answer, and you need to listen and realize that it's not all going to be writing a prescription. You may have to step outside the box and do things that are just purely lifestyle modification, purely diet, exercise, supplementation, not necessarily reaching for the prescription pad right away. So I think to answer your question again, I think it's just the access to coordinated care is probably the most frustrating part of medicine that I see.
Absolutely. So, what's one thing your patients have taught you that medical school could have never taught you?
Well, again, I think it's listen, and learn so you can learn and heal. Um, and I think that's I can't say this enough. You have to listen to the patient. They're going to tell you what the problem is, and you're going to use the physician is going to use their tools to essentially come up with a diagnosis and a treatment. And the other part of it is you have to care. You really have to care about your patient. You have to care about the outcomes. You have to care about staying on top of new treatments, knowing what's out there, knowing what the patients are going to be looking at and coming to you asking for assistance with. Or what's even worse is they don't ask you for assistance and they start doing things on their own that you don't necessarily know that they're doing. So an example would be, methylene blue is all the rage right now because RFK Jr. was seen putting methylene blue in a glass on an airplane, and everyone said, "What is this that he's doing?" And everyone started using methylene blue. Methylene blue is a textile dye that has been used for over 100 years in a functional medicine standpoint, and in a highly purified form where you've removed the heavy metals. It has tremendous applications for mental health, for inflammation, but the problem is it acts as what's called an MAOI, which is a monoamine oxidase inhibitor, which doesn't mean anything to most people out here other than to say that it increases serotonin. And if you're on an SSRI, which is a selective serotonin reuptake inhibitor, which is Zoloft, Paxil, Prozac, Effexor, medications that a lot of people are taking, and you take methylene blue on top of it, you can cause something called serotonin syndrome. And serotonin syndrome is when you have too much serotonin in your brain, and it causes a lot of bad things to occur. So this is something that again, for the coordination of care, I can't stress it enough, not to get too technical on the mechanism of action of methylene blue or the SSRIs or monoamine oxidase inhibitors. You want to be careful what you're combining, and supplements can be just as dangerous as combining prescription medications. So I think that's certainly another reason you really do have to listen and you have to care about the results that you're getting. I think that again, going back to the question, what's troubling you today? Invariably, they're going to answer you, and you're going to have to do something about it. You have to listen to them, and then go back to the Popkin method again, which is standardized care. I'm going to go do my history, my physical. I'm gonna do everything I can. Lab work, imaging, whatever I need to find out what the problem is, and then the treatment is the same. It goes back to the same blueprint: lifestyle modification, diet, exercise, supplementation, or appropriate supplementation. peptides if necessary, and then of course prescription medications if necessary. So it's not rocket science. It's following a system where you listen, you learn, you care, and you provide good, solid medical advice and medical treatment.
And I know I'm super excited about the Popkin method and getting deeper into this conversation. But what can our listeners expect from future episodes of the Popkin method?
Well, I'm really excited. This is the first of a series of podcasts that we're going to do. And really, this just described my style of medicine, how I practice medicine. So the curriculum that we're going to be going through in the upcoming podcast series will cover things like weight loss using supplements and the GLP-1 medication, semaglutide and tirzepatide. That's all the rage right now. It's been, it's all over the internet and get, access to these medications pretty much everywhere. I've been using them for years and years in my practice. I've never seen something explode in popularity this quickly. The medications are effective. In most cases, they're safe if used appropriately. So that's going to be the next podcast episode. After that, we're going to do hormone replacement therapy, both for men and women. So testosterone replacement in men, and estrogen, progesterone, testosterone replacement in women. Yes, women do get testosterone replacement. So that's going to be an interesting podcast. Hair restoration. I mean, everybody, all males and females who are losing their hair or getting thinning hair are concerned about that. And there are lots of really good things that we can do to prevent that and to treat that. Sexual health and erectile dysfunction treatment. This is something that, patients feel stigmatized about, and in years past, they never talked about it. And then with the advent of medications like Viagra and Cialis, it became more in the forefront. And I think it's something it's very important for both men and women. It's not just a health concern, it's also a relationship concern because, unfortunately, sexual dysfunction can affect people's relationships. So this is something that patients are very interested in, and I think it'll be an interesting podcast for our listeners. Muscle gain and maintenance. So one of the main themes that I like to focus on as a longevity expert is the addition and the maintenance of muscle. So from the time you're a teenager and in your 20s and your 30s, it's fairly easy to gain muscle, and you want to acquire as much muscle as possible because in your 40s and 50s, that muscle mass starts to decline, and it's important because muscle is your glucose reservoir, meaning excess sugar will be taken up by the muscle. So the more muscle you have, the more glucose control you have, and that means the less diabetes you're going to see in the population. Muscle also, for obvious functions, it helps you to be stronger and prevent falls. So this is important in later life when patients develop osteoporosis. They may develop neurologic issues. The older you get, the worse consequences you get from a fall. So when you're 30 years old and you fall down, typically nothing happens. 40s, 50s, same thing. But as you get into your 60s, 70s, 80s, and on up, falls can be catastrophic. So you want to have as much muscle mass as possible to prevent falls. So we talk about that, and really the gaining and maintenance of muscle. We talk about the foundation of protein intake, trying to achieve 1 gram of protein per pound of ideal body weight spaced throughout the day. Proper supplementation. We talked about creatine. Creatine is fantastic for helping to maintain lean muscle mass, to provide energy so that you can build those muscles as well. We're going to talk about that. Peptides, one of my favorite topics. There's so many different peptides out there, and probably the one that most people would recognize. Well, insulin's a peptide, so that's the most recognizable. Another one of the peptides that you'll hear a lot about is the Wolverine stack, which combines BCP 157 with TB 500. This is something that athletes are using to help recovery from injury. And now that it's becoming more mainstream, you get a lot of people that are interested in this, weekend warriors and so forth that may have injuries. They're getting really good results with using this Wolverine peptide stack. So I'm very excited to talk about that in our peptide podcast. Stem cells and exosome therapy. This is another one that I'm really, really excited about. I have a lot of experience using stem cells over the years and now exosomes to help with acute and chronic type injuries. And this is something that we're seeing a lot more occurring, a lot of these procedures occurring more because it's becoming more reasonably priced. Years ago, it was $20,000, $30,000 for a stem cell injection, and now, it's come down in price to a couple $1,000s. You combine that with PRP, platelet-rich plasma, and we're getting really good results for lots of different acute and chronic conditions. Chronic pain management, and I'm not talking about pain management with narcotics. I'm talking about pain management with, again, lifestyle modification, weight loss, proper supplementation, supplements that help with decreasing inflammation. We talked earlier about omega-3 fish oils that help with inflammation, turmeric or curcumin. This is another supplement that we use. And again, I'm not saying that we're not going to use other over-the-counter medications or prescription medications, but again, it's a blend of these things to help spare use. Let's say we'll use more supplements to help spare the use of prescription medications or over-the-counter medications that could damage your liver, such as Tylenol, or your kidneys, such as ibuprofen. So again, it's a mix of functional medicine and internal medicine. And lastly, well, not lastly, but low dose naltrexone. That's going to be a really interesting podcast. Naltrexone being a medication that is used to get patients off of narcotics, but in low doses, it has tremendous utility for inflammation, um, for cancer prevention, cancer adjunct treatment as well, not to mention mental health issues. So that'll be a very interesting podcast, both for patient listeners and physicians who would be listening to this, because I learned about low dose naltrexone from a patient, and I had no idea, I had no idea at the time what it was used for. And again, it goes back to what I was saying before. Listen, listen to your patients. Well, I happened to listen to this patient, and he taught me about a novel treatment that I use today in my practice that's actually quite helpful for many, many people. And then gut health is huge. Unfortunately, with our current food chain, the soils are depleted of nutrients. The foods are irradiated. There's antibiotics and other chemicals in the foods, microplastics, all sorts of things that interfere with the gut. And the gut has a connection with the brain. So typically, we see issues that are multifactorial. So gut health is really something that's quite important. And interesting fact: 70 to 80%, if not more, of your brain's neurotransmitters are either made or manipulated in the gut. So that's where you get that gut brain connection, which is why gut health is so important. And lastly, mitochondrial health. I talked about methylene blue earlier. Methylene blue helps to improve energy, and it does so by improving mitochondrial health. Mitochondria are the powerhouse of the cell. It's a component of the inside of the cell. I won't geek out on you and go into a whole biology lesson about cellular function and so forth, but the mitochondria make the energy within the cell. And as we age, we don't do this as efficiently. So there are a lot of things that help to improve mitochondrial health, methylene blue being one of them, alpha lipoic acid being another. There are many different things that help to improve mitochondrial health. So that's going to be a very interesting podcast as well. So that's a summary of the topics that we're going to be talking about in future podcasts. And if anything that I talked about today resonated with you, feel free to reach out, and I would love to talk to you more about this. Thank you for listening.
Amazing. I cannot wait to hear more. I know our listeners are excited to hear more. And that's a wrap on episode 1 of the Popkin Method. We hope you felt seen, heard, and maybe even validated. If you have been stuck in the cycle of lab tests, prescriptions, symptoms, and still no real plan, it's time for something different, something doctor led, something real. Make sure you subscribe, share this episode with someone who needs clarity. And if you're ready for more personalized approach to your health, please reach out to Dr. Popkin. He knows what he's talking about here. He's ready to help you. This is medicine reimagined. This is the Popkin Method. Thank you, and I will see you all next week.